Communication and Nursing by Janice Arenas. Being a nurse is a wonderful experience. Not only is it a job dealing with medicine, but it's also a job dealing with many different types of people. Many kinds of people walk in the door every day with a different problem. Some people come in with very serious injuries. Some are minor and everyday problems. With all these people coming into the door every day, it can be confusing on how to speak to them. Today, I'd like to discuss the importance of communication and talk to you about the book Communication in Nursing by Julia Balzer Riley. Communication plays a key part in nursing. As Julia Balzer said, you can make a difference in a patient's life by practicing caring, assertive, and responsible communication. As small as it may seem, knowing how to talk to a person is vitally important, especially when you are dealing with major life issues. Julia Balzer Riley is the author of this book. While writing this book, she established her credibility by interviewing many different nurses. She also interviewed members of health departments, quality and safety education for nurses members, and chairman of many different schools of nursing. In this speech, I will discuss the basic necessities needed to communicate properly, how to be respectful and use consideration to your patients, and how to deal with unreasonable people and requests in the workplace. First off, let's discuss the basics of proper work communication. It is important to know how to be an interpersonal communicator. In order to be an interpersonal communicator, you must be able to perceive nonverbal cues, such as facial expressions and vocal cues. You must also take into account the environmental factors, this being possibly the physical distance between you and the person you're talking to, and you must take into account the location of the conversation, and if it has any impact on the person. You must also be an assertive communicator. It requires an ability to talk to someone without feeling anxious. Being assertive is being able to clearly discuss the matter at hand without any expense to others around. An assertive nurse must appear to be confident and comfortable. Behavior as well plays a huge role in being assertive. You will make mistakes, but you must be responsible enough to accept what you have done and what you have said. You cannot be shy and tenuous, nor can you be abrupt or abrasive. But you must strive to show that you are confident in yourself and in your work, while also being considerate to the person you're talking to. Next, we will discuss how to be respectful and considerate to those around you. Being respectful and considerate while speaking can be a bit of a task all on its own. Respect is an important thing to establish in a nurse-patient relationship. It is the foundation for any kind of health interventions. It allows the patient to know that you care for their needs and their concerns. If respect is ignored, it creates tension between the patient and the nurse and prevents trust to build. Respect not only plays a key role in work, but in life as well. It is important to utilize it whenever possible. Being considerate and empathetic also plays a mighty role when developing a nurse-patient relationship. It is important to always see how the patient is feeling emotionally. As a nurse, your demeanor is always taken into account during your work. The way you talk to others, how you present yourself, and how you listen is always perceived by the patients around you. It is important to be aware of the hardships the patient is going through in order to know how to handle the situation with sensitivity. Now that we have discussed the basic needs to communicate on a regular basis, let's now discuss how to communicate when a problem arises. It can be difficult to disagree with someone while in the workplace. Let us take a look at how we can manage that. On a daily basis, nurses are constantly receiving requests. But how can you handle an unreasonable request? Typically, an unreasonable request will consist of affecting your ethics or values. You must handle the situation assertively, not aggressively, and let it be known as to why you cannot comply with their requests. With aggressive clients, it can be more challenging. You must always remember to breathe and stay as calm as you possibly can. Be sure to increase the aggressor's awareness of abusive behavior and to limit his behavior as much as possible. In conclusion, it is important to know how to communicate in the workplace, especially when your job must deal with people on a daily basis. An important thing to know is that no matter what field of work you go into, it's important to use the correct usage of communication with others.